You know, when we talk about AI in healthcare, it's easy to think of something way off in the future, maybe a bit like science fiction. But that whole conversation, it's changed. It's not about what AI could do anymore, it's about what it's doing right now. In this explainer, we're going to cut through all the noise and look at the real, tangible impact AI is having in hospitals today.
So that brings us to the big question, right? Is all of this just hype? You know, a bunch of cool-sounding projects that aren't really going anywhere? Or is AI actually on the front lines, making a real difference, and yeah, already saving lives? Well, let's dig in and see what's what.
Okay, to really get a handle on how AI is being used in a hospital setting, it really helps to break it down. We can basically sort all of its functions into three main buckets. It gives us a super simple framework for understanding its role. First up, you've got clinical decision support. Think of this as AI being an expert consultant, helping doctors nail down a diagnosis. Second is operational analytics, which is all about making the hospital itself run smarter and more efficiently. And third, there's workflow enhancement. This is where AI just automates all those repetitive tasks, freeing up our amazing doctors and nurses to focus on what they do best, taking care of patients. All right, let's jump right into that first category, clinical decision support, and go where it matters most, the exam room. This is where AI is becoming this powerful sidekick for doctors, boosting their skills when it comes to diagnosing and treating diseases. And we're going to look at some absolutely fascinating real-world examples from the front lines. And honestly, there's no better place to start than with oncology. I mean, the fight against cancer is one of the toughest, most complex challenges in all of medicine, and it's one of the very first places where AI is truly making a life-saving difference.
Just look at this number. 5 years. That's not a typo. It represents this giant leap forward in early detection. There's an algorithm developed by Alkin and the NYU School of Medicine that can look at mammograms and predict a patient's risk of getting breast cancer up to 5 years before a doctor could officially diagnose it. I mean, think about that. A 5-year head start? That's not just early detection. That could completely change how we think about preventative medicine.
And this isn't some isolated fluke. Check this out. At the Miami Cancer Institute, an AI model boosted diagnostic accuracy by 10%. Over at UNC Lineberger, an AI's recommendations for chemo plans matched the human oncologist plan 97% of the time. And at Johns Hopkins, AI figured out if the treatment was working a whole 5 months earlier than standard methods. These aren't just numbers on a slide. These are real, tangible wins in the fight against cancer. Now, this incredible predictive power, it's not just for cancer. Let's pivot to another huge area. Cardiology. Heart disease is a massive global problem, and AI is now stepping in to help predict and even prevent the worst-case scenarios for patients. So a huge goal with heart failure patients is preventing them from ending up back in the hospital. Well, a model used at one clinical center was able to identify 93% of the patients who were likely to be readmitted within a month. Think about that. It lets the hospital flag those high-risk people for extra care before they have another crisis. That's a game changer. And the applications just keep rolling in. An AI at the Mayo Clinic can spot arrhythmias on ECGs just as accurately as a top cardiologist. Another system can process cardiac CT scans looking for dangerous plaque buildup 60 times faster than a person can. See, these tools aren't replacing the experts. They're supercharging them with speed and a second set of eyes that never gets tired.
Okay, for a second, I want you to imagine you're a radiologist. Every single day, you're staring at a literal mountain of scans, and the pressure to not miss one tiny critical detail is just immense. It's a perfect recipe for burnout. And this is where AI is becoming this absolutely essential assistant, helping manage that insane workload and, crucially, prioritize the most urgent cases.
And that help has direct life or death consequences. This 35%, that's the improvement in stroke detection from an AI algorithm that automatically analyzes head scans. What it does is it pushes any scan with a potential stroke right to the top of the radiologist's to-do list. Faster diagnosis means faster treatment, and when it comes to a stroke, time is everything.
So far, we've been focused on AI as this diagnostic partner, right there in the exam room. But its impact goes way, way beyond that. This is where those other two categories we talked about, operational analytics and workflow enhancement, come in. This is about optimizing the entire hospital to be safer and just plain smarter. Take a look at this timeline. It's for sepsis, a really dangerous response to infection. At one hospital, an AI system that was constantly monitoring patient data flagged a patient who was developing sepsis a full 6 hours before the hospital's standard alarms would have gone off. In the race against sepsis, 6 hours isn't just 6 hours. It's an eternity. It's enough time to start life-saving treatments and completely change that patient's outcome.
Or let's talk about a problem that affects literally every patient: nurse staffing. The old way of doing it was basically guesswork, which often led to overworked nurses and high turnover. But now with AI, hospitals can use data to plan things out, analyzing patient numbers and needs to create schedules that are just smarter.
And would you look at the results? One hospital system that brought in AI for nurse planning saw its staffing costs drop by up to 15%. But here's the amazing part. At the same time, patient satisfaction scores actually went up by 7.5%. It's a total win-win. It saves the hospital money, and it leads to better patient care. So when you pull all these examples together, a really clear picture starts to form. The future of care isn't about AI replacing our doctors and nurses. No way. It's about creating this powerful partnership where technology makes human expertise even better and lets our clinicians be the absolute best they can be. And that right there is the key takeaway. This isn't just theory anymore. AI is way past the let's try it out phase. It's being scaled up into real solutions that are delivering real measurable improvements in how we care for people, and it's happening right now. So the evidence is pretty clear. AI is already transforming healthcare, and it's already saving lives. The power of this tool is just undeniable. So the real question for our future isn't if we're going to use it, it's how. How do we weave these incredible tools into our daily lives and our medical care to make absolutely sure that the focus always stays on the patient? That's the conversation that's going to shape the future of medicine.